many weight loss products contain stimulants, and that can affect heart rate and blood pressure. Is Capsimax okay to take in those terms?
Yeah, in terms of a hemodynamic response, in terms of blood pressure, or in terms of heart rate, most of the studies have noted, minimal effects when you compare the treatment, the Capsimax or the capsaicinoid, in comparison to the placebo in terms of a blood pressure difference or a heart rate difference. So there's some slight increase, in most studies. By slight, I'm talking about a few millimeters of mercury or maybe a few beats per minute in terms of heart rate. But in terms of cardiac abnormalities or in terms of any sort of statistically significant increases in blood pressure or heart rate, most studies have not reported that. And we've essentially shown the same. The blood pressure and heart rate response is almost identical to treatment. And the Capsimax blend study essentially showed the same as well. So I think that's interesting, and that's important for people that potentially are going to use a product like this or a quote weight loss product. Many of the weight loss products, of course, in the market are stimulants.
They are stimulants.
And because of that, looking at the demographic of people that are using weight loss products, which may be individuals who are overweight or obese, and oftentimes people who are overweight and obese or obese will have issues with hypertension or cardiovascular disease, etc. They don't want to be using a product that's going to increase their blood pressure 10 or 15 millimeters of mercury. That would be a real concern, I'm sure, to their physician. So, and it should be to them as well. So something like this, I think, is of interest because it has efficacy in terms of what they're wanting, in terms of the energy expenditure and potentially lipolysis and appetite suppression, but it doesn't appear to be associated with any sort of significant cardiac changes. And I think that's important. That being said, of course, they want to talk to their physician or their pharmacist who likely knows more about these issues and just let them know that I'm thinking of using this. What do you think? And they should get some sort of clearance from them as opposed to the manufacturer or me or anyone else that's discussing these things.